Of the many types of dressings available for various types of wounds and various stages of healing, transparent adhesive films or wound barriers have unique properties that make them especially suitable for superficial wounds, as well as partial thickness ulcers and burns. Transparent wound barriers act as a temporary skin. They are impermeable to fluid and bacteria, but allow oxygen and moisture vapor to pass through them, thus allowing the wound to breathe. These properties also make a transparent wound barrier a good choice as a cover dressing for autolytic debridement of necrotic tissue. They seal in wound fluid, thus allowing the enzymes in the fluid to digest the necrotic tissue. The moist environment they create also helps to speed epithelial cell growth. These dressings cannot absorb moisture, however, so they are best suited for wounds that have light or minimal exudate, or for superficial wounds, such as stage 1 and some stage 2 pressure ulcers, as well as minor burns and lacerations. They provide protection against friction, and because they are transparent, they allow easy assessment of the wound. Transparent film dressings are also used to cover the intravenous catheter insertion sites, again because they facilitate visualization of the site without removing the dressing and risking bacterial contamination. Because they are self-adhesive, no secondary dressing is required, and they eliminate the need for dressing changes as long as the dressing remains intact. Because they are waterproof, the client can bathe or shower without affecting the wound or the dressing. And because they adhere only to intact skin, they can be removed without disrupting the wound. Prior to applying a transparent wound barrier, you will check the provider's orders and follow your institution's policy for the specific procedure. Before you begin the procedure, explain it to the client and evaluate her ability to cooperate with you as you change her dressing. Have assistance available as needed. Now let's go ahead and demonstrate applying a transparent wound barrier to an adult client's superficial wound. We'll assume the nurse has checked the provider's orders, explain the procedure to the client, and review the manufacturer's instructions for applying the dressing. The nurse assembles her equipment. She will need clean or sterile gloves, scissors, alcohol or acetone, a moisture-proof bag, wound cleaning supplies as needed or prescribed, the wound barrier dressing, and paper tape. Next, the nurse provides privacy and assists the client into a comfortable position that allows good access to the wound. She assesses the wound, any drainage, and the stage of healing. She then washes her hands and puts on clean gloves. If necessary, she would clip any hair around the wound that might keep the dressing from adhering. She then cleans the wound and surrounding area as prescribed and dries the surrounding skin with sterile gauze. Next, the nurse removes part of the paper backing on the dressing and applies the dressing to at least 1 inch, that's 2.5 centimeters, of surrounding skin at one edge of the wound. Gently, without stretching the dressing but still keeping it free of wrinkles, she lays the rest of it over the wound, working from the edge where she began toward the opposite edge. She then frames the dressing with the paper tape to keep the edges from curling up or becoming loose. After applying the dressing, you'll remove your gloves and dispose of them in the proper receptacle. Make sure the client is comfortable, then wash your hands. Document your dressing change, your assessment of the wound, any wound care you provided, how the client tolerated the procedure, and any other concerns or observations in the client's record.